If you've recently received the results of your low back imaging and been diagnosed with a disc herniation, you might be wondering, what does that actually look like in your own body and what is happening? My name is Dr. Robin Armstrong. I'm a chiropractor at Willowbrook Chiropractic in Langley. And luckily I have a new model that we've been using from Dynamic Disc Designs. And the thing that's great about it is it's movable. So this is going to help me talk to you a little bit more about what is going on with your disc bulge or herniation or protrusion or extrusion, whatever words or language might have been used on your imaging report. So first, let's orient to the model. So this is the part of your spine you can feel. So when you touch your back and you feel that bony part, this is the back of you. That's the spinous process. These are the vertebral bodies, we call them. And in between, you can see there is a disc. Now, apart from the fact that this model has a concentric disc bulge, you can see the disc is protruding beyond the body of the vertebrae. It's a relatively healthy spine in that there's no bony arthritis. So on your imaging results, you might have found out that you have maybe some spurring at the joints themselves. So you can see when we move, these are the facet joints right here. That's how we flex and extend and rotate as movement happens there. And so sometimes over time, the cartilage can break down, the bone responds by rebuilding in sort of a spiky, irregular manner. So you might have some spurring there. They call that facet joint arthrosis or degenerative joint disease there. Then you can also have less space for the disc. So this model has a good amount of space, but when it's less space in there, we call that degenerative disc disease. So we know that you have probably been diagnosed with a disc bulge or a disc herniation. This is an L4, this is an L5 vertebrae. The most common area for us to get a disc bulge is between L4 and L5. Second is L5 and S1. And you can see these are the nerves coming out. So here is our spinal cord, which becomes our cauda equina, which is like a series of nerves in kind of like a horse's tail. And then they come out between the vertebrae. So you can see there's an opening there. That's where the nerve comes out. So when we have a disc bulge like this, you can see it takes up some of that space where the nerve is. And if you were to have a protrusion, meaning that it's bulging out and kind of, it almost makes like a pyramid shape, bulging out a little bit more, it's very common for it to happen at the side and at the back, which is right where this nerve comes out. And so that creates less space for the nerve. It might even contact the nerve, and likely your imaging report will tell you whether or not it looks like the disc is actually in contact with the nerve. And that's when we start to get pain in the leg, numbness and tingling, maybe a lack of sensation, maybe a lack of strength, and sometimes back pain. Now, it can progress and get a little bit worse. So this bulge happens because there's fibers around the disc and on the inside, and luckily on this model we can kind of see through the middle. So the clear part here, that's the jelly center, the nucleus pulposus. And then the white part on the outside, with a little bit of red and blue there, that's the annulus fibrosus. Now what can happen is with repetitive loading, then the fibers can start to tear. And so they start to tear from the inside, and you can see kind of a tear here, that red, and then eventually it spreads to the outside. So it starts, then we get that protrusion, and then it can get worse, and we can actually get a complete tear, and then the contents of the nucleus pulposus start to extrude. And I'll go even closer. You can kind of see, there it is, it's coming out. And then as we release that loading, it goes back in. So usually in flexion with rotation, then it squeezes out. And then if we go back to neutral or even into extension, then it gets sucked back in. So that's why it's really important that when you are lifting, we are keeping that neutral spine, meaning we are keeping the curve in our spine. So we're not flattening it. We're not especially rounding it, because you can see that goes even more out. We're keeping it neutral and keeping that curve. And that's also why we prescribe extension exercises, because when we go forward, the disc bulges back. When we go backwards, the disc gets sucked in. So if you want to learn more about your particular case and disc herniations in general, you can watch our video all about lumbar disc herniations. We also have all about how we treat disc herniations, because it is possible for you to get treatment and get some pain relief in our office. And we also have exercises for low back disc herniations, many of them extension type exercises that prevent that bulging, that protrusion of that nucleus pulposus inside the disc. So I hope this dynamic disc designs model helped you understand your problem and your imaging results a little bit more. If you have any questions about what I've talked about here today, please feel free to ask myself, Dr. Robin Armstrong, or Dr. Jody Freedman. We're always happy to help.